So our next speaker, I'm really pleased to introduce one of my colleagues from UBC, Patrick Bayliss, who's from the School of Public Policy at UBC. And Patrick works actually on this human side, so actually how do humans actually respond to interventions and to air quality. So Patrick.
Thanks, Michael. I've really been enjoying the talks. Unfortunately, I've been enjoying them from my hotel room upstairs because I picked up something nasty on the way over. So in order to not pass that along to any of you, this is why I'm wearing the mask. How do I control this? Great. Okay, so as Michael said, I'm a social scientist. I'm an environmental economist. And that leads me to think a lot about how people behave and how people respond to different types of either threats in their environment or alerts about threats in their environment. I'll speak broadly about a lot of different studies, and I guess I see my role here as helping convey both findings and context around findings and how we maybe can evaluate some of the different findings in this area. Only one of these studies that I'll discuss is actually one of my own. So a lot of this on this slide has been covered by previous speakers in a comprehensive way, but let me just say a little bit about why I think behavioral responses are really important to understand both the threat of smoke and how people respond to that threat and how people respond to public health information systems designed to help them respond. Wildfire smoke, as we've found, is a major contributor to air quality problems and an increasing contributor in both Canada and the US and elsewhere in the world. In the face of these smoke threats that are unlikely to abate in the near future, alerts are kind of a primary tool for helping people mitigate some of those effects. For alerts to work, two things need to happen. First, people need to be aware of them, so they need to be connected to the public service agency that is delivering the alert, and they need to receive it, they need to read it, and they need to internalize it. And then the second thing is, beyond internalizing it, they actually have to do something, right? They just have to change their behavior. So these are kind of simple points, but I think it articulates why we think understanding behavioral responses is really valuable. A related question, and I think a question that helps inform how we think about the response to alerts, is how people respond to the threat itself, to smoke itself. So as I said, my goal over this next 20 minutes is to provide a kind of an overview of what we know from this literature, perhaps not entirely comprehensive, but covering kind of as much as we can through the view of some specific studies. So these are the motivating questions that were helpfully provided by the conference organizers. I'll just go through them now, and then we'll come back at the end of the talk and see what we've learned. The first is, do people change their behavior based on the Air Quality Health Index and other air pollution messages? The second is, what populations or individual characteristics help determine the likelihood of behavior change, and what are the barriers for people to adopting those behavioral changes? The third question is, do people become desensitized, right? So if you issue an alert 1, 2, 3 days in a row, does the response vary over that period? Does it fall, or does it stay stable? What are the characteristics of effective messaging in air quality alert systems? And then what information sources tend to be trusted by the public? So we'll come back to all of those in due course. I'm going to start by just speaking to what we know about behavioral responses to air pollution information. So think about this as air quality alert systems. I'm going to primarily focus on work. I'm going to focus entirely on work that's from North America. I'm a bit lazy, so my first step in trying to understand a literature is to see if anybody else has done all of the hard work for me. And I'm lucky enough in that somebody did at least part of this review that I was thinking about in preparation for this talk already. So Donatella D'Antoni and her co-authors provide a systematic review of findings from 21 different survey-based publications. There's a couple things that I'd like you to keep in mind as we talk through some of these results, and there's actually quite a lot more in this paper that is worth reading through if you have the time and capacity. But keep in mind that this review, and this is sort of the state of the literature that speaks to the motivating questions that I just described, most of these are going to be survey results only. So as social scientists, and maybe economists in particular, we have a bit of skepticism, or at least an awareness of disconnect between what people say and what they do. So these are going to be surveys that ask people what they say they think they're going to do in the face of an alert. I think that's important to keep in mind as a baseline. We don't think that these are studies that are information-free. They're useful, but I'm also going to spend some time talking about studies that looked specifically at behavior to kind of help enrich this perspective. Okay, the second limitation that's worth mentioning is that these studies were specifically those where respondents already knew about the warning system. So that's sort of a logical sample selection to get cleaner data to think about, but it's maybe not such a useful sample selection if you're a public policymaker who wants to speak to everybody or to think about everybody in your population. Another thing to keep in mind. Okay. The main findings in the review are that the reduction in outdoor activities, or at least claimed reduction in outdoor activities, range from about 10% to about 50 to 60%. The median or the central tendency was about 31. So this is a fairly significant reduction in outdoor activities. Demographic factors, interestingly, did not predict this behavior across studies. So some studies found that income was important. Some studies found that income was not important. Some studies found that risk factors were important. Some studies found that it was not, right? This is a systematic review, so we're trying to characterize the findings of a broader literature. They did find more consistency across what they called psychosocial factors. So by psychosocial factors, they meant factors that sort of characterize how people think about air quality and air quality information. People who knew where to check for the warnings, who believed that air pollution was causing some of the health symptoms they were experiencing, who perceived a high severity of threat, or received some advice from healthcare professionals that they should be concerned about air pollution, were more likely to respond to warnings. On the other hand, there's a set of barriers that were sort of generally demonstrated, which was the people who didn't understand the air quality indices or perceived a lack of control about their own exposure to air pollution were less likely to respond, as well as people who were reliant on sensory cues like visual or smelling of smoke, or if people were just pressed for time and didn't have time to look up these warnings. So this is, as I said, this was a survey this is a systematic review of multiple survey data. Some of these survey data, if you're interested or inclined, are available for your own perusal. So for example, this is actually a study that came out after the systematic review by folks at Boise State. And what they've done is they've asked a lot of these kind of categories of questions that they made the data set available online. So all of this is to say, especially when these data sets are available, these are a potentially very useful source of information about some of the questions that we care about. I won't go through all of the categories of questions that they had, the questions that they had, but the categories are, they asked people about their demographics, they asked people about their activities, they asked people how much they knew and how often they received air quality warnings, their perceptions about smoke, and then health-related questions. And just to give you a sense for what this lets them think about, a first kind of cut at these data. This is you can tell by the fact that I'm on figure 32 here. This is a paper with a lot of different figures in it. There's a few useful insights just to be seen from some of those responses. So I'm not sure if you can see this. I can barely see it myself. But they using the US AQI system, they asked people what AQI rating causes you to reduce your outdoor activity, and the modal answer was orange, which I forget in the US system exactly what that is, but it's sort of a moderate level of air pollution. And then they also asked across the surveys, which factors cause participants to limit their outdoor activities, and you're going to have to see if you can read that yourselves. I can't read it myself. Anyway, the point is, there are data sets out here that can help us kind of revisit these questions, especially these behavioral questions, and while they contain the limitations that I mentioned, that they're more about what people say they'll do than what they actually do, they're a valuable source of information about how people at least think they'll respond. Okay, so now I want to turn to some studies that focus more on the actual behaviors that respond. And you know, sort of admittedly, this is going to be mostly focused on outdoor behaviors because that's where we get data on responses. The first is a study by folks who are all at Canadian universities, Siberian et al. And what they looked at, this is actually data from Australia, but they looked at air quality alerts in a city in Australia, and they looked at the degree to which an alert reduced the level of cycling observed at, you know, those cycling monitors that you see on the street. So you can read these kind of annoying numbers as percentages, basically, so just like multiply by 100. And what this is telling you is that in total, an alert reduced cycling activity by about 14%. And this is controlling for air quality. So that's important, right? It's not just the fact that air quality is higher, it's that there was actually an alert issued. It's on top of whatever the air quality effect is. The second is that weekdays and weekends had different effects. This kind of makes sense, right? If you have more ability to shift your schedule, or if you're cycling purely for recreation, maybe you're less likely to do so, whereas if you're cycling for getting to your place of work, you don't have the ability to shift away from that. So this is a fairly large response, but it's less than the central tendency of what people report they would do. The second study, and again, this is another annoying table. The second study comes from Josh Graf-Sivan and Matt Nidell, and this is a study that basically observed visits to a zoo and visits to an observatory. Just focusing on the first and the third column, what this study says is they observed on the first day of an alert a 15% reduction in visits to the zoo, a 5% reduction in visits to the observatory. What's sort of additionally compelling about what they're doing here is they have a handful of days where they get to see what happens when multiple alerts are issued each day. And what they see is that the second alert has no effect that's statistically distinguishable from zero. So the fatigue of receiving these alerts sets in very quickly, and we see that people on the second day of the alert essentially act as if no alert has been issued at all. I'll just summarize a few other findings in the literature quickly. In terms of demographics, elderly users, so this is another study looking at visitation, but this one is for parks. Elderly users and exercisers tend to be the biggest reducers in uses of outdoor activity at a park. Elderly users had a relatively modest reduction of about 2%. Exercisers reduced by about 25%. Again, vigorous outdoor activities, this is another study, goes down by about 20%. This is actually from time use data. And then this third one is from more survey data. About 20% of participants met the following criteria. They were aware of the Air Quality Health Index. This is a study from Canada. They checked the Air Quality Health Index. They followed the Air Quality Health Index. And they therefore had adopted the Air Quality Health Index, 20%. That number is basically the same for the elderly and at-risk population. So these are pretty low kind of adherence or adoption of these health indices. The final point was on a study that looked at communication channels. And what they found among different communication channels is that most people, at least in, I believe this study came from 2018, most people were receiving communications via television. The second most was app-based alerts, and then after that was social media. So in terms of communication channels, television, at least of several years ago, was still king for the channel by which people receive these things. Here are the references. Okay, so that's the coverage of the response to alerts themselves. Now I want to broaden this a little bit and talk about responses to smoke specifically. How am I on time? Great, perfect. Okay, so kind of separately interesting and related is the question of how people respond to the threat of smoke itself, irrespective of air quality alerts or even holding constant the presence of alerts. The first study that I'll highlight is a study that uses data from purple air monitors. So these are we talked about purple air a little bit already this morning. The data from purple air monitors can be made publicly available, much of it is. What these authors are doing is they're using that data to compare how people who live in low-income census tracts versus high-income census tracts are exposed to indoor air pollution when outdoor air pollution goes up. So what we've got on the x-axis is the amount of smoke, and then the bottom panel is outdoor air quality. So those are fairly similar across across different levels of outdoor air quality, but between people living in higher versus low income areas. The divergence appears when you look at the indoor air quality of folks who are exposed to high levels of outdoor air pollution. The divergence appears between people of different income levels, or at least living in areas with different income levels, when it comes to indoor air quality. So this is reinforcing what several of our speakers have already kind of noted. I think Bill and Robin touched on this. Indoor air quality reflects outdoor air quality, but the degree to which it does so depends on characteristics of the building envelope. Characteristics of the building envelope often depend on, or at least relate to, socioeconomic factors. So if you live in a house that's less well sealed, for example, you are less able to protect against the threat of outdoor air quality. And this, I should say, this is probably a coarse cut at this differential. They're using census tract income, which a census tract in the US is several thousand people. So that's a big area to be collapsing income over. I suspect, and Purple Air doesn't provide these data, but I suspect that if we knew exactly what the household income was for these folks, we would see a bigger divergence. Okay, along that line, this is a paper that I participated in and helped with. The question of smoke avoidance can be measured kind of at individual levels or at the survey level. It can also be measured at kind of population scale remote sense data. So our goal in this study was to answer the questions: how do people actually change their behavior to wildfire smoke at the population level, and how do those responses vary by the level of income that they have? So what we did very briefly is we had a measure of PM concentrations from wildfire smoke that we estimated, and then we looked at how those measures compared to 4 different categories of responses. The first is salience. And salience is literally just how much are people Googling air pollution, air quality, wildfire smoke, and I think smoke as well. Second is health protection, which is also Google searches, but these are those relating to air purifier, air filter, and smoke mask. And then sentiment. Sentiment comes from Twitter data, so using geolocated Twitter data, we are able to measure kind of average emotional valence of posts across space. And mobility is from anonymized cell phone ping data that's provided by Safegraph. So what do we find? So this first set of graphs, which also is semi-unreadable, is the response across levels of air pollution, so levels of PM, levels of smoke-based PM. The first is that salience goes up in air pollution and then levels out around 30 or 40 units of PM 2.5 from smoke. So people are aware of smoke, they're responding to it. The second, in the bottom left panel, is that we see sort of a similar relation for demand for health protection, at least searches for health protection. We see in Twitter sentiment that people are responsive in the sense that their sentiment goes down, so their kind of expressed valence, just how they're talking online, falls as well. And this isn't just specifically people posting about smoke, this is people posting about anything. And then finally, we see that mobility, so this is the degree to which you exit, the degree to which you stay at home goes up as smoke increases. So these are they're not unit free, but they're not super useful units for saying that it's like a percentage increase. But it is useful, I think, to compare these across income levels. So again, we're measuring income using census data. We don't know the exact income of each of the people in the sample, but we know roughly what it is based on where they live. The first is that salience doesn't vary at all across income. So people are kind of equally salient depending on how wealthy they are. The second, this is the bottom left panel, people who live in wealthy areas are significantly more likely to start looking for health protection online as air pollution increases. Sentiment decreases slightly, so the sentiment effect kind of falls in increases in income. And then mobility, so the ability to respond to air pollution threats increases as income levels go up. So all these kind of are consistent with other evidence that we have that wealthier populations are better able to respond to this threat of smoke. More evidence on this front comes from a paper by Stephen Holloway and Ed Rubin that looks kind of similarly at cell phone ping data, but they're asking a slightly different question, which is not who stays at home during a smoky period, but who gets out. So who actually exits and goes to an entirely different county when smoke arrives. They see that, unfortunately I've cut off the x-axis here, but it's actually the same one as the last slide where we have poorer people on the left and wealthier people all the way on the right. As you get to wealthier and wealthier people, they're more likely to exit. So that goes from about a negative 0.75% to up to about 1%. That's actually not a very big number. So I think it's important to keep in mind the kind of baseline that we're starting from. That's on the right-hand side of this chart. This is just, on average, how much do people travel out of their county. Forget that whether it's a smoke day or not. That obviously also rises in income. So you can think about basically just adding all of the dots on the left to all of the dots on the right to get the relative effect. And there would be, of course, some increase, but in terms of like overall propensity to travel, this doesn't change a whole lot. Okay. This is a paper by Brianna Batdorf and Tara McGee that actually also systematically reviews literature related to responses to smoke threats, but it specifically does so with the lens of understanding how this affects indigenous communities. I'll just summarize some of their findings. This also is a really excellent piece of scholarship, and I if this is a question that you're interested in, I recommend taking a look. Indigenous communities, particularly in Canada, are heavily and disproportionately threatened by wildfire smoke. It probably won't surprise any of you. For those communities, TV and radio are key communication channels. Some of the effects of smoke are forcing people to stay inside, which has led to a reduction in community cohesion and opportunities to interact. Inadequate housing, carrying on with the theme, has been kind of a prevalent issue, which suggests that these important infiltration differences matter in this setting as well. And then finally, they summarize another study that discusses the take-up rates of evacuation support, air purifiers, and masks, which to my eyes were relatively high compared to estimates from the general population, suggesting at least for some of these communities, providing public health support can be really valuable. Okay. Other sort of related findings that I'll just briefly go over. This is totally consistent with everything we've heard today. Folks who left their windows open for more than 12 hours a day experienced significantly higher levels of black carbon. Folks who had a perceived likelihood of taking actions I'll back up. When people said that they were more likely to change actions, that tended to correlate with them saying that they felt more vulnerable versus when they said that they felt there was a higher kind of overall risk. So to say, people are more responsive to their own vulnerability than to a perception of overall risk for the community. A lot of people do rely on kind of sensory or olfactory cues to decide whether or not to be concerned about wildfire smoke. And then this is another kind of revealed finding. In addition to exercise, one population that is heavily affected by the presence of smoke is the outdoor recreation communities. We see, it won't surprise you, that we see a big reduction in wildfire smoke, in visits to national parks in the face of wildfire smoke. Okay, so let me try to pull some of this together and get back to the motivating questions. The first message for me from reading through this literature is that people do change their behavior in response to air pollution messages. It's less than they say they will, but it is non-zero, and the magnitude of their response varies quite a bit depending on who you're thinking about and what actions you're talking about. Exercisers and elderly people are likely or more likely to change their behavior. Higher income respondents are also more likely to take steps to avoid air pollution. We do find some evidence of alert fatigue, and I didn't mention this when I talked about that paper, but at least one of the papers that I reviewed suggests that a day in between alerts helps to alleviate that degree of fatigue. So being strategic about when to call air quality alerts may be valuable. There's not a lot of work that compares different types of messages. I think there's certainly space for more and better research on this topic, but to the extent that we at least have survey responses about what people think effective messages would look like, it's those that emphasize personal threat. So you got to scare them about their own kind of personal vulnerability, and you have to provide actionable advice, right? So if you just scare them and you don't provide them anything to do, nothing happens. If you don't scare them, nothing happens. That's sort of a coarse description of what the findings are. But, and I guess the final thing in response to the final prompt, TV and mobile phone applications are the most common source of air quality alerts, at least of the last time that I know of this being studied. So thank you very much. That's my email. I'm not going to stay in this room any longer for your safety, but I would love to chat further offline if you like.
Well, you will stick around for a couple questions, hopefully. So, questions for Patrick in the back. Go for it.
Yes. Thanks so much. That was super interesting. You focused a lot on the general public and their actions to protect themselves. I'm curious if you found in your look at the literature much information about how professional partners respond to some of these alerts. We get questions from municipalities, schools, daycare operators, and so I'm curious if for folks who are mostly making decisions for the protection of others, if you found any differences or if there's any literature that speaks to that.
It's a really good question. I did not find any specific literature looking at, you said professional partners as in schools, people kind of responsible for other folks' health. I did not see any of that in reviewing the literature. I think part of that is kind of a structural weakness of social science research, which is that it's easier to study individuals because you can get a larger sample more easily than it is to study schools, for example. Sorry, I wish I had a more clarifying answer.
Hey, I'm just curious with the focus on trying to scare them and the individualist perspective, if you saw anything in the evidence that suggests there might be differences based on communities, say maybe more collective communities versus more individualistic, if that type of messaging might shift their actions. Or if we know where that research came from, was based in.
So most of what I was summarizing in describing those findings was people responding to surveys about what elements of air pollution messaging they would find effective. To the extent that I'm aware, and I could be missing pieces of this, there isn't evidence that differentiates that by, as you said, more versus less individualistic communities. I guess drawing on other social science research, there's certain settings where taking advantage is not the right term, when like kind of leveraging community-oriented norms has been valuable. Now I'm thinking mostly of like a development econ literature that thinks about kind of shared insurance or overlapping insurance. So I guess I could imagine that there would be differences. I don't have any evidence to give you today that says something about that.
Great, last question.
Yeah, just curious your findings about trust in the messaging depending on the source or the nature of the messaging.
So the survey or the systematic review that I mentioned looks a little bit at trust. I guess one of the sort of expected things is that trust matters. The challenge is that the degree to which you actually assess how trusted these sources of information are is not really something that you can directly measure and like generalize to a place. So I guess all I can say is that trusting the source of information was important according to that study or according to the review of studies.
Great, thanks again, Patrick. Take this up to your hotel room and feel better. Thanks again.